UNICEF, and from my own U.S. Mission, U.S. Embassy, as the United States donates 1,534,850 Johnson & Johnson vaccines to Nepal through the COVAX facility. This is a gift at no cost from the American people. Today's delivery of this single-dose vaccine means that this single donation is enough to protect over 1.5 million people in Nepal from the deadly effects of COVID-19. We are sharing these vaccines not to secure favors or extract concessions or advance any other interests. We are sharing them without strings attached, and our terms for engagement are and always have been open and transparent. Namely, we're doing this with the single objective of working with our partners within the government of Nepal to save Nepali lives. These vaccines will help Nepal emerge from the pandemic. They will also help recover economic losses and regain the opportunity to safely visit with our friends, our families, our neighbors, and get back to work. The United States is the nation that has the unenviable distinction, I'll be clear, of losing more of its citizens to COVID-19 than any other country on earth. We have lost over 600,000 of my American citizen friends and colleagues. We know how vicious this disease is, and we understand that this virus does not respect international borders. A challenge like COVID-19 requires partnership and an equitable, truly fair global response. The United States is also the world's largest donor to global health by far, including through international efforts like the Global Fund and the World Health Organization, and through our own outstanding global health programs like PEPFAR, which has helped bring the world to the cusp of the first completely AIDS-free generation. The United States is also the largest single country contributing to Nepal's COVID response, to date contributing over $70 million to Nepal in assistance. This funding has provided testing kits, pulse oximeters, emergency medical supplies, personal protective equipment, telemedicine support, ventilators, oxygen tanks, supplies, breathing devices, and today, life-saving vaccines. As a very proud member of COVAX, we have made a $2 billion contribution which will supply COVID vaccines to low and middle income countries. And on top of that, we've pledged another $2 billion that we'll provide as other countries also step up and fulfill their own pledges. President Biden's administration recently stated that we, as the United States of America, share these vaccines to save lives and to lead the world in bringing an end to this pandemic with the power of our example and the power of our values. We are using that example of our democracy, of the ingenuity of American science, and the strength of American humanitarian assistance to beat this pandemic. And at the same time, we continue to leverage our long-standing partnerships with countries to solve these pressing issues. This is what the United States has been doing for nearly 75 years in Nepal. In partnership with the government and the people of Nepal, we have addressed health challenges such as eliminating malaria and mobilizing national nutrition campaigns to reduce child mortality. And we will continue to work across our agencies as our Department of Defense provides critical health commodities and long-term disaster relief assistance across a range of governmental and civil society partners in Nepal. And USAID's work building Nepal's healthcare capacity, disaster preparedness, education, and climate resiliency, among much more, has helped define our partnership with Nepal. Because of our decades of cooperation between our two countries, and I would say especially all of the decades of cooperation with the Ministry of Health and Population, today millions of Nepalis are living healthier lives and participating more fully in their communities. So you see, today is not a single event. It's not a one-off. This is the latest chapter in that partnership and that belief that working together we can produce healthier outcomes. Today is undoubtedly a momentous day. in our efforts to beat this virus. But let me be clear, we're not naive. We know that most of our work still lays in front of us. That's why the United States will continue to support Nepal in the weeks and the months ahead, and I hope through continued contributions like the one that we see today, knowing that we are here, standing by your side as we always have been. So, to you reporters in the room, let me ask you to disseminate the message also to continue to follow science, take precautions, wear your mask, wash your hands, practice social distancing. So stay safe, everyone. Namaste.
महत्त्वपूर्ण कार्यक्रममा हार्दिक स्वागत गर्न चाहन्छु। हामीले भर्खरै अमेरिकी सरकारको तर्फबाट जोन्सन एन्ड जोन्सनको 15 लाख मात्र खोप उपहार स्वरूप प्राप्त गरेका छौँ, जुन हाम्रो नागरिकको जीवन रक्षाका लागि वरदान स्वरूप हुनेछ। तसर्थ यस पुण्य कार्यका लागि अमेरिकी सरकार, अमेरिकी जनता, महामहिम राजदूत तथा राजदूतावास परिवार कोभ्याक्सका साथै यस कार्यमा प्रत्यक्ष तथा अप्रत्यक्ष रूपमा सहयोग गर्नुहुने सबैलाई हार्दिक आभार एवं कृतज्ञता व्यक्त गर्न चाहन्छु। आज प्राप्त भएको खोप प्राथमिकताको आधारमा जोखिम समूहका व्यक्तिहरू तथा 50 देखि 54 वर्षको उमेर समूहलाई लगाउने गरी योजना बनाएका छौँ। यसका लागि स्वास्थ्य सेवा विभागको प्राविधिक टोली तयारीमा जुटिरहनु भएको छ र जुटिरहेको हुँदा छिट्टै खोप अभियान सञ्चालन गरिने पनि छ। हामी कोभिड-19 को महामारीसँग जुझ्नका लागि होल अफ गभर्नमेन्ट तथा होल अफ सोसाइटी को माध्यमबाट अगाडि बढिरहँदा अमेरिका सरकार तथा हाम्रा अन्य साझेदारज्यूहरूबाट प्राप्त सहायताका लागि अत्यन्तै आभारी छौँ। अमेरिकी सरकारबाट नेपालमा कोभिड-19 को सुरुवाती अवस्थादेखि नै भेन्टिलेटर, परीक्षण किट लगायतका सहायताका सामग्री तथा प्राविधिक सहायता प्राप्त भइरहेको छ। उक्त सहायताले परीक्षण तथा उपचार व्यवस्थापनमा ठूलो मद्दत पुगेको छ। कोभिड-19 को दोस्रो लहरसँग जुझ्न नेपालले सहायताका लागि आह्वान गरेको छोटो समयमा नै अमेरिकाबाट ठूलो परिमाणमा व्यक्तिगत सुरक्षा सामग्री, अक्सिजन सिलिन्डर लगायतका सहायता सामग्री प्राप्त भएको छ। साथै युएसएडको समन्वयमा देशका विभिन्न अस्पतालहरूमा तरल अक्सिजनको भरपर्दो व्यवस्थापनको लागि तरल अक्सिजन ट्याङ्क राख्नका लागि भइरहेको सहयोगको लागि दिनमा अक्सिजनको अभाव हुने छैन। अप्ठ्यारो परिस्थितिमा नागरिकको जीवन रक्षाका लागि उक्त सम्पूर्ण सहायता अत्यन्तै सहयोगी रहेको छ। उक्त सहायताका लागि अमेरिकी सरकार, अमेरिकी जनता तथा समन्वयका लागि राजदूतावास तथा युएसएडलाई धन्यवाद ज्ञापन गर्दछु। कोभिड-19 को रोकथामका लागि खोप नै उत्तम विकल्प हो। कोभिड-19 को रोकथामको लागि खोप नै उत्तम विकल्प हो। यसलाई मध्यनजर गरी हामीले सुरुवातमै आवश्यक कानुनी, नीतिगत तथा व्यवस्थापकीय तयारी गरी 72% जनसङ्ख्यालाई कोभिड विरुद्धको खोप लगाउने लक्ष्य राखी खोप उपलब्धका लागि सम्भावित सबै विधिहरू अवलम्बन गरेका छौँ। तथापि खोपको उपलब्धता चुनौतीपूर्ण रहेको छ। यसै सन्दर्भमा अमेरिकामा उत्पादित जोन्सन एन्ड जोन्सन, मोडर्ना तथा फाइजर खोप खरिद, प्राप्ति तथा आपूर्तिको प्रक्रियामा आवश्यक समन्वय तथा सहजीकरण गरिदिनु हुन महामहिमलाई विनम्र अनुरोध गर्दछु। अन्तमा आज यो खोप प्राप्तिमा महामहिम राजदूतज्यूको विशेष नेतृत्व र समन्वयका लागि पुनः हार्दिक धन्यवाद ज्ञापन गर्दछु। यस अवसरमा युएसएड मार्फत नेपालको स्वास्थ्य क्षेत्रमा विगतदेखि हुँदै आएको सहयोगको उच्च प्रशंसा गर्दै युएसएडले कोभिड-19 व्यवस्थापनमा विकास साझेदारीहरूबीच खेलेको नेतृत्वदायी भूमिकाको लागि समेत आभार प्रकट गर्न चाहन्छु। धन्यवाद, नमस्कार।
First and foremost, these were the vaccines that we had access to in terms of what we could provide. And then, of course, there was a very close collaboration with the Ministry of Health to make sure that we're providing the type of vaccine that is most appropriate, most highly effective here in Nepal. So that has been an ongoing conversation with the Ministry of Health all throughout as we take a look. So we continue to take a look and look at availability of all three of these vaccines as we move ahead. I don't have any information that I can share on that right now, just to say that the conversations continue. To the issue of commercial procurements, those really are an issue, although we can help, of course, facilitate contact with those commercial suppliers. The U.S. government doesn't really play a role in those negotiations. So that would be a subject of discussion directly between the government of Nepal and the American provider. So where we become involved is really where we see vaccines that are being provided as a form of assistance through the COVAX facility are vitally important to communicate the needs, because that indicates the will of the bureaucracy, and so I believe that is an important part. I think that as we worked through our own processes to identify vaccines, this is obviously something that is in global demand. So there was a great deal of discussion about about the shape of the pandemic, about the capacity, about the ability to get effective vaccines into hands as quickly as possible. Because although I think that kind of communication is important, of course, the driving factor for us is to get as many people vaccinated as quickly as we can. Because it's a clear view from the United States perspective that this is an enemy that we're fighting that doesn't look at somebody's passport, right? It's going to attack Americans or Nepalis equally. So I think that it's a clear view from my government's perspective that as long as COVID remains a danger to any country, it remains a danger to every country.